Hello and welcome to the Mental Health Reform podcast, where we pass the mic to people doing incredible work in the mental health area in Ireland. Today we're touching upon a subject which many of us may know by feeling but not by name: anticipatory grief, the acknowledgement of grief and loss before death. This type of grief can also come with conflicting feelings of guilt and a lack of outside understanding. This can be a sensitive topic for many, so I'd like to take the time here to let you know that if this brings up something for you, there is support available and will be signposted at the end of the show. To talk about anticipatory grief, I have not one but two guests here today: Una Holstead, Clinical Coordinator of the Curragh Family Resource Centre, who have published a recent book on this important topic, and Maria Cleary, the CEO of Community Therapy Ireland, a member of Mental Health Reform and whose vision is for an Ireland where high quality counselling and psychotherapy services are fully accessible to all. It's great to have you both here today. Thank you so much for coming.
Thanks so much for having us.
Thank you.
Thanks, Stephen. Good to be here.
So I guess we can jump right in. So Una, my first question is for you, if that's okay. Anticipatory grief is such a tender concept. It acknowledges grief before death. Why do you think it can be a struggle in talking about this subject?
Yeah, I suppose in thinking about this, there's so many factors, and each situation, of course, is so unique. I suppose, in a way, the very idea of thinking about, let alone talking about, somebody's upcoming death can be really uncomfortable, for both the person who is dying or who's been given a diagnosis, and for those around them. And I suppose the struggle that you ask about can be so multifaceted in terms of the range of emotions that the whole period of anticipatory grief can bring up. I suppose if we were to think maybe initially from the perspective of an individual person who's been given a diagnosis, our role often is not a medical one. It's around support, it's around meeting families, meeting people, around the impact of what's happening to them. I suppose what we often hear and see is people describing the absolute shock, of getting this information. And then how to put language on that can even be difficult. So this can often be way before there's clarity. I think one of the struggles is uncertainty. There's a huge uncertainty that comes along often with the period of anticipatory grief. So even though you might have a diagnosis, you may not have definitives in terms of time, in terms of what's going to happen, in terms of what you might need, in terms of the type of care. And so that can all add, that's one of the many, many areas that can be hugely complex. The other thing, I suppose, which is in a way what inspired the putting together of this book and the sort of desire to fill a gap with how invisible sometimes this experience can be for people. So, as you said at the beginning, it can be a very felt experience, but maybe not something that's named or talked about in a huge amount. And I think that when I say invisible, I suppose what I'm thinking about and what I mean is that perhaps if you think about somebody who is a family member or themselves have a diagnosis of a really long life-limiting illness, people might be sympathetic towards that and might have some sense of what that might mean, but they might not think of it in terms of well, that means that this person's going to die, and certainly not feeling they can ask those questions. And I suppose what really emerged was the desire that some people had and families had and parents had with their children to be able to have those conversations about what it meant to have a diagnosis and to experience anticipatory grief. And I think that, there's so many areas that it impacts. The kind of ripple effect, I think, was language we used quite a lot in terms of anticipatory grief, that if you think about relationships and people's, I suppose, sense of who they are, the meaning, frustration often, anger, guilt, I think it brings up such a range of emotions, and I think that can also add, to that piece, that struggle around why it can be such a difficult area to think about, to experience, to talk about. And then the whole idea of hope, I think hope, that in a way is, if you start talking about or asking about the grief that might happen afterwards, or the experience, and this person's going to die, are you in some way giving up on hope? And is there permission for that? Is that okay? Start talking about that. That concept of hope can change, and we can think maybe about the hope of having a good death, or the hope of having really meaningful conversations, or the hope of sharing memories, the hope of having shared really nice experiences with the person who's going to die, so that idea and concept of hope maybe can shift with the reality that somebody is going to die, and when the person is going to die. So there's a whole range, as you can see, in relation to why this is, as a human experience, can be really complex.
Thank you so much. I mean, I'm happy to disclose, like, I have a family member who passed away from dementia several years ago, and it's that no man's land between knowing and not knowing that the person that you love is no longer there, but they're still alive as well, and knowing that to manage our expectations of what hope is, like to your point, hope that we can find a way to have peace, or hope to have acceptance as well. It's something that was very difficult to wrap my head around, I think, because do we feel shame because this person is still around but they're not the same person anymore, and it often leads to a lot of isolation, confusion, guilt for feeling these things in the first place. But as we know, like all feelings are valid, and many of them will happen at the exact same time. But it's to know, like, if for somebody reading this book as well, that they're not alone is so important.
Yeah, absolutely. And I think that one, guilt, one of the things certainly that we've experienced in the work, and people have talked to us about, as part of the process of really thinking about this whole area, is that experience sometimes that the person dying can sometimes will that to happen sooner, because they feel, they're perhaps a burden on those, or don't want to be a burden on those around them, or they're really, really exhausted from the illness, and then the guilt of that, that is that okay to feel that, how can they give themselves permission to have that feeling? So it can be so complex. So to have permission to even have these conversations, to maybe be brave enough sometimes to ask the questions, can be so important, and can be such a relief, for people who may have these thoughts, and they may be fleeting thoughts, but it can be so important. And I think a lot of people would probably be able to identify with what you're talking about, that real dilemma, when you have somebody and you're mourning their loss, and they're still there.
Thank you so much, Una. And maybe moving away from the emotional lived experience of anticipatory grief, Maria, if I could ask you from a human rights perspective, how can we understand anticipatory grief, and why is it important that policymakers and community services recognise it as a social and indeed a collective experience rather than just an individual one?
Thanks for that question, Stephen. And I really want to acknowledge, thank you for sharing your own experience. And I'm very humbled listening to you and Una. You have very beautiful language to describe what is ultimately a very emotional and a personal experience. And I suppose I bring a slightly different lens here, where I acknowledge that anticipatory grief is often treated as a very private and personal experience, but in reality it is also shaped by the structural conditions that we live in. So it could be shaped by our access and the quality of our physical and mental health systems. It could be shaped by poverty and caring responsibilities. And also it could be shaped by the societal attitudes to illness and loss. So the right to health is a core fundamental right, and that includes mental health. And it's not just about access, but it's also about quality. And the precise language that refers to the health right is the highest attainable standard of physical and mental health. And that also includes control over one's own health and death. So from the perspective of the UN Declaration on Human Rights, Article 25 in particular enshrines the right to adequate standard of living, and that encompasses healthcare and social security. And these two are very much intertwined when we talk about anticipatory grief. Likewise, the International Covenant on Economic, Social and Cultural Rights, and in particular Articles 11 and 12, they detail the right to health and they make it a binding obligation for states. And that is our most detailed framework that emphasises availability, accessibility and quality. And it's really worth reflecting that in the UN infrastructure, there is no covenant on mental health specifically, but mental health is captured in some of the other instruments that we have. For example, in the EU Charter on Fundamental Rights, Article 35 includes a right to health care. And in terms of the Convention on Rights of Persons with Disabilities, that specifies that the actualisation of rights I've mentioned so far are equally owed to persons with disability, including older people living with mental health difficulties and those living in care settings who are especially vulnerable to human rights violations. And I suppose it's really important to be able to tease out these human rights instruments that specify how anticipatory grief is a valid rights-based principle, something that we need to protect and uphold. And bringing a rights-based lens to this conversation emphasises non-discrimination, dignity and participation, and access to high-quality supports, which are all frequently compromised when people face anticipatory grief or long-term decline or impending loss. So really recognising anticipatory grief as a personal issue as well as a human rights issue. It helps us clarify that the social experience and the state obligations need to go hand in hand to reduce administrative burdens on individuals and families experiencing anticipatory grief, and to design through national policies compassionate systems that uphold the rights of people experiencing anticipatory grief.
Thank you so much, Maria. Thank you. It's great to have that, the idea of how it's enshrined in human rights. I'm just imagining, like, on my left hand we have the UN, UNCRPD, and on my right I have, say, my experience as well, and like the gulf that can exist between them. Something that you talked about was the social attitudes, and indeed maybe like the very Irish social attitudes that we have towards bereavement and loss. And I think there's maybe a lot of work around shame, guilt, and keeping it to yourself as well. So I wonder, maybe for both of you, is there a way that we can bridge that gap?
That's a really good question. One of the things that really impacted my own engagement with the research that the Curragh Family Resource Centre has published was around the voice of a family experiencing anticipatory grief, and how through their journey, which is objectively very tough, and there's complex health and mental health challenges that are being experienced, how the family that hold their rights go through the reality of the healthcare and the mental health system really changes through time, and really changes depending on what they experience in terms of their physical or mental health, their stigma and their social attitudes of health practitioners, as well as those around us. And that could make a real difference in the lived experience of anticipatory grief.
I was thinking, listening, to you, Maria, and thinking about the question you've just asked, even around the idea of power. You know, I think of rights and power, and of course, one of the things so many people describe and experience is powerlessness. You know, when they've been given a diagnosis, or and also with the uncertainty that can come with this. You know, that I really was thinking about that idea of powerlessness and those are things we can do, and certainly I think the family, you know, you're thinking about, you're inspired in putting together of this resource. You know, they kept asking questions, and sometimes there aren't always answers to the questions, but I think that's really important to ask, you know, and to try and get clarity where you can, and then it can maybe be easier. I don't know if easier is the right word, or try and figure out what are the bits that you can't do anything about. And I think that's really important.
That really resonates with me, and I think, you know, that sense of, irregardless of what the cause of what is driving that anticipatory grief, like irregardless of the physical or mental health condition that is driving that impending loss, that people need to have that power to ask those questions, to ask for the highest level of care. And I really think that in particular around mental health, there's so much stigma, you know, there's just so much stigma that is still very felt in how people reflect on their story and in how they use their story as they describe their own journey through anticipatory grief.
Yeah. And I think just picking up on that need for understanding from a therapeutic point of view, like our understanding clinically has changed a lot over say like the past 100 years, where the person is gone, that relationship is severed, you move on to maybe something more humanistic where we have this idea of continued bonds. And Una, that's something that was evident in the book. It spoke beautifully about these continued bonds, maintaining connection even after death. I wonder if you could explain to the listeners a little more about this concept, and how do you see this approach changing how we manage closure?
Yeah, it's such a beautiful concept, continuing bonds, and such a lovely way to maintain connection. That's how I see it. So I suppose, yes, the thinking now, thankfully, you know, is that there's an understanding that even though somebody may have died, that there is a way and there is permission, I suppose, to maintain a connection and contact in a relationship, albeit very different than what it would have been when they were still alive. That keeping a connection, having a relationship with the person in a different way can be so important and so, I suppose, helpful and comforting. And in some ways, maybe people always found their own way to do that. There might be something that will remind them of the person who died, or a certain song they'll listen to, or a certain ritual that people will have. I know certainly for certain events, I will always wear a bracelet that my grandmother bought me, you know, and I do it instinctively, you know, and it, I suppose in a way that is a way of maintaining a connection. Certainly over the years, I've been really privileged to meet lots of children in terms of anticipatory grief and bereavement work, and, you know, children find the most creative, wonderful ways of writing letters to people and updating them, making beautiful photo montages and memory jars, having ways that to keep that memory of the person present and relevant. And I think that's that piece that you mentioned, that there used to be this sort of thinking that, you know, you need to move on, the person has died, you know, your period of mourning is over, that, you know, that may have silenced so much in terms of what people really were feeling. And right now there is, and you know, there's more to do, I think, as you alluded to, you know, in terms of understanding and work around bereavement and grief, but there is much more of an understanding and compassion around continuing that relationship. And even in terms of people asking, you know, tell me a little bit about, you know, who that person was. I'd love to hear more about it. You know, that I think we're less afraid thankfully, to keep the memory of somebody and the connection with somebody going, which is really reassuring, actually, and has such an impact.
Maybe it's about seeing closure not as the closing of a book, but the closing of a chapter. And I'm just thinking, say in the family situation when the loss is happening, how can children be addressed in it? I know certainly from my past experience, like it was something that like children would have been shielded away from, for their own safety, for my benefit. But what do adults often underestimate about a child's capacity to process these truths?
My experience over the years, and I really have to struggle to make sure I can't think of any exceptions, but I'm pretty sure I have yet to meet a child who was angry about being told the truth about something difficult. Where I have met lots of children who are angry because they weren't. And again, that's broad in general. Children's capacity to hear and take in what's often very difficult information is quite incredible, and isn't to be underestimated. If you start from something the child already knows and then build on it, and then no more than us as adults, giving autonomy, giving choice. There's some more I'd like to tell you about what's happening. Would you like to know? But in the long term, certainly in my experience and our experience in the area of work, the long-term impact of including children in allowing them to ask questions is so important.
As a mommy, I find this conversation is so helpful. But one of the things that I absolutely loved about this resource is that it contains a list of resources for children of different age groups. Una, do you want to talk about that? Like, I think that the resources are so gorgeous and it's really worth mentioning them.
Yeah, no, absolutely. When we think of children, and again, each child is different and would have a sense of what different children like and are able for, but there's different developmental phases. So, very young children, there's that lovely sort of magical thinking phase, and as children get older, and as Maria says, it's laid out in the book really nicely, but there are some lovely pieces, maybe to give an example of creating memory jars with children, where it gives an opportunity to talk about different memories, different things about the person that they really like, that they would really like to hold on to. And it's a lovely way of starting conversations with children. When you open up and ask children to remember certain things. So that can be really, really lovely. Were there other ones that you were really struck by, Maria, that you felt might be
Yeah, I absolutely love the fact that there was different activities for different age groups. And I think when I think about anticipatory grief, and when I think about the times in my life when I have been in that space of anticipatory grief, for me a key word that comes to mind has always been care. Wanting to care for that person that you're losing, and wanting to care and respect their life. And I think it's the unknown, right? It's the unknown from the perspective of a parent, and it's the unknown from the perspective of a child. Like, we don't know what the right things to do are. And sometimes our creativity could be a little bit stuck in that grief. And I just thought to have a suggested list of ideas to do with your child that is so enabling. I just thought, it's helpful, it's specific, it gives you a way to practice that care and love and respect in a very tangible way.
Yeah. And I'm just thinking, as you're speaking, one of the things often in that period of time in families, things can be very heavy and huge sadness and heavy emotions around. And one of the things that we would often ask children to think about is, what are the things that make you laugh? Like, what are the things this person used to do that, was really funny? Things like that really think about all of the things about this person, both that you're going to miss, but also that you really love.
Love that. Love that question of what are the things that make you laugh about that person. Like, that is so gorgeous. I'm going to use this. I was scribbling as you were speaking, and I'm going to hold on to this and use it.
Yeah. There's so many ways of capturing those moments that can be done in really short nuggets. And obviously sometimes when people are unwell, or depending on what's happening for them, energy levels might be low. So many things that you have to factor in, but there's also so many possibilities that can be done. And with supportive adults around children, they really can get involved, which can be super.
And the book itself, Strength for the Journey, Navigating Anticipatory Grief, it's a very personal navigation from like the lovely examples that you showed there. But I wonder, Maria, if from your role as CEO of Community Therapy Ireland, are there ways that rights-based community support structures can help protect people from feeling marginalised, or any avoidable service gaps when they are navigating their own anticipatory grief?
Yeah, that's a really good question. Thank you, Steve. I suppose it's really important to say that Strength for the Journey, Navigating Anticipatory Grief is a resource that is very specific to our lived experience in Ireland, and that makes it very valuable. So if you think about the mental health infrastructure in Ireland, anticipatory grief is reflected in national policies and strategies such as Sláinte Care, Sharing Division, the National Carers Strategy, the National Adult Palliative Care Policy, the National Standards for Bereavement Care following pregnancy loss and perinatal death, the National Cancer Strategy, the Model of Care for Dementia in Ireland. So there's very rich infrastructure, right? And yet the lived experience of people living with anticipatory grief shows profound challenges and gaps in service provision. So community-based services such as the Curragh Family Resource Centre, and indeed the Community Therapy Ireland members across the country, they are often the first responders for families, and yet they remain under-recognised and can be under-resourced too. So this publication, it really is foregrounded in the lived experience of a family and a community living in the Midlands in Ireland. And a family living with anticipatory grief is at the heart of it. So you could have somebody who really needs time and space and flexibility from a work perspective to grieve and to honour that process of anticipatory grief. Or you could have somebody who finds safety in routine, in ongoing work commitments. So it's really, that onus is on workplaces, on people who have a line management responsibility, but more than that, on all of us, because we create a work culture to talk about what safety means.
And I suppose in doing that, knowing that over time that may change and will change, so being able to check. And I really like that, Maureen, what you're saying, because absolutely, for some people, going to work might be the break they need from all of what has changed and feel completely unfamiliar in their personal lives. And so maybe having a space in work where they can take a break from that might actually be really important.
Any final comments?
I loved listening to both of you. I loved listening to your language as you described anticipatory grief. So thank you. Really wonderful to be with you on this podcast.
Thank you so much.
Thanks so much. Thanks, Stephen. Thanks, Maria.
Thank you both. The publication is called Strength for the Journey, Navigating Anticipatory Grief. It's published by the Curragh Family Resource Centre, and the link to the publication will be included on our show notes, along with safe and confidential supports.